6% as of this morning. That progress has cooled off a bit across Illinois. We are seeing changes in positivity averages around the state level off, with 3 regions that were decreasing last week now sitting at a stable level. 2 others, Region 9, that's Lake and McHenry counties up on the border with Wisconsin, and Region 5, actually flipping from decreasing to increasing positivity. To offer credit where credit is due, Region 3, home to Springfield and Quincy, is the sole region to flip from an increasing positivity rate to a relatively stable rate in the same time period. Currently, we have 2 regions that are sitting above IDPH's 8% threshold, Regions 4 and 1. Region 1, home to Rockford, Dixon, and Galena, entered tightened mitigations on Saturday, October 3rd, and Region 4, the Metro East region, has unfortunately required heightened intervention since late August. After falling from a peak 7-day average positivity of over 10%, Metro East then leveled off between an average of 7 and 8% positivity for several weeks, and has recently dropped to a new low of 6.3% as of this morning. That's enormous progress. And if the region sustains an average below the 6.5% threshold, Region 4 could see a return to the looser mitigations enacted in most of the state as soon as Friday, perhaps. All of this takes place in a landscape where Illinois is continuously increasing our ability to test for and monitor this virus. We're now pushing an average of nearly 60,000 tests a day, and this morning we surpassed 6 million tests completed to date, less than 3 weeks after we were one of the first states to cross the 5 million benchmark. There is testing available to you if you need it. Whether you've potentially been in contact with a COVID-19 case, if you're feeling unwell, if you just want to check in, you're able to get a test, and you can get a test at no cost. With that, I want to briefly turn to the upcoming elections. As governor, by a combination of constitutional law and state statute, I don't control the State Board of Elections, nor should I. That said, I do have a duty to the citizens of this state to do 2 things. First, to do all that I can to ensure your constitutional right to vote is secure. And second, to do my best to ensure that you're able to vote safely. If you want to wait to vote on Election Day, that's your right. But I want to make sure everybody knows about all the things that we've done here in Illinois to ensure that you can vote safely and securely. And that includes expanding early in-person voting for those who want to avoid crowds on Election Day, and vote by mail opportunities for those who want to avoid the broader in-person risks of the pandemic. I'll start with early in-person voting. In Illinois, people have been voting early in-person since September 24th, though that start date has varied by county. The city of Chicago, for example, started early voting at a central location on October 1st, and that will expand to all 50 wards in Chicago next Wednesday, October 14th. Check with your local election authority to see what options are available to you in your city and your county. I also signed legislation earlier this year to increase access to voting by mail in this election by making sure that all registered voters who cast a ballot during the 2018 general election, 2019 consolidated election, or the 2020 primary election had the vote by mail application mailed directly to their home address. A record number of registered voters have returned those applications. And if you want to vote by mail, you can apply online right now. You have until October 29th, but don't wait. The State Board of Elections recommends that you apply for your ballot by October 15th, if not sooner, so that your ballot can be delivered to you on time. In Illinois, your vote by mail ballot, which will arrive after you send in your application, needs to be postmarked by or on Election Day. But don't wait. The State Board of Elections is recommending that you mark your ballot and return it as soon as possible. In more than 50 of our 102 counties, you can also drop off your ballot postage free at a secure collection site or a drop box instead of sending it through the mail to your local election authority. The legislation that I signed also designates the 2020 election as a state holiday, requiring the closure of local government offices, K-12 schools, and public universities, making it easier for people to take time to go and vote in person on November 3rd if they choose to do so. We also expanded early voting hours and worked with the State Board of Elections to dedicate $4 million to subsidize ballot drop boxes and increase pay for local election judges across the state. If you haven't registered to vote before, but you're eligible and interested, please make your voice heard. The last day to register online is October 18th, but you can register in person up to and on Election Day. That means you can go to any early voting location in the next few weeks and register and vote there if you'd prefer not to wait. If you want to register to vote right now, you can do it on your mobile phone. I'm going to give you the address, the website that you can go to, and that address is ova.elections.il.gov. Again, to register to vote right now online, go to ova.elections.il.gov, G-O-V. If you're wondering what you can do to help make sure voting is safe and secure and accessible for everyone, there are two easy ways to help your community. First, choose to vote early in person or to vote by mail to reduce the size of crowds at polling places on Election Day. That'll help everyone be able to keep their distance during this pandemic. Second, I encourage young and middle-aged people who are not immunocompromised to step up and volunteer as election judges in your communities, a role that your elderly neighbors have so often embraced as part of their civic service on Election Day. You can sign up to become an election judge by contacting your county or city clerk's office. And if you decide to vote on Election Day, November 3rd, I want to emphatically encourage everyone to wear your masks. Encourage others to wear their masks. Watch your distance and wash your hands. And we will all put public health first, of course. There will be fewer infections if you do these things. And that means fewer restrictions. And for all of us, that means a stronger and safer Illinois. So thank you. And with that, I'll turn it over to Dr. Ngozi Ezike.
Thank you so much. Thank you so much, Governor. Talking about the regional metrics, county metrics, positivity rates, hospital admissions, emergency department visits, hospital bed availability, and all this data can be confusing. Public health officials are working with millions of pieces of data. If you look at just tests alone, you just heard the governor announce that there are more than 6 million tests that have been done in the state of Illinois. That's more than 6 million pieces of data to be collected, tracked, sorted, and analyzed. I know there's several sayings out there about data and how the numbers can be used to support almost any argument. An economist once said, if you torture the data long enough, you can get it to confess to anything. And some people may be doing that, but I want to assure people that IDPH is being transparent with the data, sharing everything about COVID-19 while still protecting our residents and their right to privacy. Our one and only goal is to collect the data, make the most informed decisions to protect the health and wellness of the people of Illinois. We also want to see the people use this data and follow along confidently alongside IDPH. IDPH will continue to work diligently and transparently to provide meaningful data to all of you. In the last 24 hours, 58,820 lab tests were reported for a total of over 6 million tests. Today, we are reporting 2,630 new cases of COVID-19 in Illinois for a total of 307,641 confirmed cases. Since yesterday, regrettably, we announced that an additional 42 lives were reported lost for a total of 8,878 deaths. 1,679 individuals were in the hospital overnight with COVID. Of those, 372 were in the ICU and 165 were on ventilators. To help reduce the burden of our hospitals and the medical system who's battling COVID flu and will also be battling flu, I urge everyone to roll up their sleeve and get their flu shot. #SleeveUp. IDPH is asking for your support and commitment to help keep our communities safer by getting your flu shot and sharing that message on social media with the #SleeveUp. Check out the IDPH website and social channels for additional imagery. And for this COVID-19 season and flu season, wear your mask, wash your hands, get your flu shot, and watch your distance. So mask up, lather up, sleeve up, and back up. And for the women, I want to remind you, this is Breast Cancer Awareness Month. Please schedule and get your mammogram. Early detection is key to beating cancer, so don't forget. Thank you. And now for our Spanish-speaking population. Hablando sobre las métricas regionales, las tasas de positividad, las admisiones del hospital y todos los demás datos puede resultar en cierta confusión. Las oficiales de salud pública están trabajando con millones de datos. Si observa solo las pruebas, más de 6 millones de pruebas, es decir, más de 6 millones de piezas de datos para analizar y confirmar. Hay varios dichos sobre los datos y cómo se pueden usar los números para respaldar cualquier argumento. Una cita de un economista ha dicho, si torturas los datos por tiempo suficiente, confesarán cualquier cosa. Y algunas personas parecen que están haciendo eso. Quiero asegurar a la gente de Illinois que IDPH está siendo transparente con los datos de COVID-19. No tenemos una agenda cubierta, simplemente miramos los datos para informar qué acciones debemos tomar para ayudar a mantener a la gente de Illinois segura y saludable. IDPH continúa trabajando diligentemente para compartir datos significativos al público y ser transparente en todos los aspectos. En las últimas 24 horas, más de 58,000 pruebas de laboratorio fueron hechas. Hoy informamos 2,630 casos nuevos de COVID-19 en Illinois para un total de más de 307,000 casos confirmados. Desde ayer hemos perdido 42 vidas adicionales para un total de más de 8,800 muertes. 1,679 personas en Illinois pasaron la noche en el hospital con COVID-19. De ellos, 372 estaban en la unidad de cuidados intensivos y 165 pacientes estaban en la ventiladora. Para ayudar a reducir la carga en nuestros hospitales que lucharan contra el COVID-19 y la influenza, pido a todos a que levanten su manga y se vacunen contra la influenza. IDPH está pidiendo su apoyo para ayudar a mantener nuestras comunidades más seguras con vacunas contra la influenza y compartir nuestro mensaje en las redes sociales con el #SleeveUp. Consulte el sitio web de IDPH y los canales sociales para ver imágenes. Y para esta temporada de COVID-19 y la influenza, usa su mascarilla, lávense las manos, vacúnese contra la gripa y observe su distancia. Estas acciones pueden salvar vidas. Y para las mujeres, una cosa más. Quiero recordarles que se hagan una mamografía. Octubre es el mes de Breast Cancer Awareness. La detección temprana es clave para vencer al cáncer, así que no olvide hacerse una mamografía. Muchísimas gracias, and with that, I'll turn it over to Governor Pritzker.
All right, we'll start with questions. Our first one is from Dave Dahl, who is asking, Illinois is one of the few states that does not tax retirement income. Why don't we publicize that? Shout it from the mountaintops to get people interested in retiring here.
Well, that's a great idea, Dave. I assume that you would put that in a headline. You should put that in a headline. You have an ink barrel, presumably. So that's a fact that we ought to be touting. And I assume maybe after this question, you might want to put that in a headline yourself. But look, I also want to point out that if opponents of the fair tax have their way, they would, in fact, tax retirement income. They've proposed that. I think that we ought to be alleviating the burden on people across Illinois. I want to preserve the ban on retirement taxes, and I stand with all Democrats opposed to raising retirement taxes. But the people who are opposed to the fair tax want to put the burden on people who can't afford it. I want to put the burden on the people who can most afford it, and that's our millionaires and billionaires in Illinois.
This question is from John O'Connor at the AP. You continue to tout testing numbers as if they're meaningful. I was tested on August 10th and didn't get results until August 17th, a worthless exercise. What good is testing if you don't find out immediately, like the president or governor have said?
Well, thank you very much for the question. And let me be clear that nearly all of the tests that are done at in-state commercial labs, that are done at our state labs, and that are done under contract with the state are done in a timely fashion and within an actionable time frame. You may be getting tested by somebody who's using an out-of-state national laboratory. And one of the problems with those out-of-state national laboratories is that the response time from them is slowed down when other states are competing to get their tests run by those same out-of-state commercial labs. So, but I'm very pleased with what we've done in the state of Illinois. Again, the vast majority are, being returned to people in a very reasonable period of time so that we can contact trace them and people can quarantine and isolate if they need to.
Greg Bishop is asking, what will you do to ensure the legislature does not tax retirement income, even those who make more than $250,000 a year in retirement?
Well, number one, we're going to get the fair tax passed. Making sure that we pay our bills in the state of Illinois is very important, and making sure that we don't put the burden on retired people or on the middle class or those who are striving to get there. Passing the fair tax is the right thing to do. It's the opponents of the fair tax that have proposed taxing retirement income. That's not something that I support. It's not something that Democrats support.
Shia at Politico is asking if the stalled stimulus talks mean the state will have to borrow more than anticipated from the feds, and whether that means cuts in jobs or services too.
I'm sorry, I'm not sure I understand. If we have to borrow, will there also be cuts? Is that the question?
She's asking if we're going to have to borrow more than we anticipated because the talks have stalled, or if that means cuts to services.
Well, we're going to certainly evaluate what our borrowing needs are, if there are borrowing needs. I still anticipate that Congress will step up to the plate with a support package for state and local governments. I want to remind you that states that are Republican run and states that are Democratic run all need support from the federal government that we haven't received. In fact, if you take a look at what the governor of Florida, the Republican governor of Florida, has said. He said his budget is, without any support from the federal government, is going to look like the red wedding scene in Game of Thrones. And, in Texas, they've seen, the worst budget deficit in their entire history. So this is not a red state or a blue state problem. Every state is going to need support from the federal government. And even though, the president has apparently thrown the talks into disarray now that he's, on a cocktail of steroids coming out of the hospital, that we are going to need this kind of support. I do believe that whoever wins the election, that the Congress and the president are going to have to step up to the plate, although I anticipate that after the election, there will be a real desire to get something done quickly.
Jim Haggerty at the Rockford Advocate is asking if there are any sources of help at the state level restaurants and bars in Region 1 can seek if the federal government doesn't approve a COVID-19 rescue package before November 3rd.
Well, as a matter of fact, there are the BIG grants, right? These are business interruption grants that we've created in the state of Illinois. It's hundreds of millions of dollars that are available to small businesses that are impacted by the COVID-19 pandemic. So businesses out there should reach out to the Department of Commerce and Economic Opportunity, go to their website. Those BIG grants are available. The big grants are, have already, some of them been given out already. There are many more available to people. But the fact is that this pandemic has been terribly hard on bars and restaurants. It's why we need federal help on bars and restaurants particularly. Because if you look at all the types of businesses, those are the ones that have been most impacted because the medical advice has been that we have to limit the capacity there more than in other places in order to limit the spread of the virus.
Kelly at Block Club is asking, what are the next steps for your criminal justice reform proposals? Would no-knock warrants be banned statewide?
I'll take the latter half of that first, yes. And the rest of it, we're going to, as you know, I put forward the basic principles of a criminal justice reform package. And I hope that we're going to be taking this up in the veto session. It's something that I've worked hard with the Black Caucus on. It's something that I know is necessary. I wish we had it in place now, but November seems like we can get it done, and I'm hopeful.
Jim Leach at WMAY, with cold weather approaching, does the state have any additional plans to help bars and restaurants when outdoor service becomes impractical?
Well, I'm hoping that we're going to be bringing down our positivity rates across the state so that in every region we'll go back to having indoor capacity for bars and restaurants. So, in the regions where we've had to impose greater mitigations because their positivity rates and infection rates have, gotten very high, again, we're providing grant availability and looking to the federal government to get more help.
Okay. Stacy Baca, Channel 7, please give us an update on your quarantine health, any COVID tests recently as well.
Well, thanks for asking. My quarantine health is great. My family hasn't seen me this much in quite some time. But I'm enjoying that, at least that part of it, being able to, immediately be home after I'm done working. Has been great for my kids who are e-learning right now, and for my wife. I've been tested over the last, it's been about 10 days now in quarantine, I believe. And I've been tested twice during that time period, and both tests came back negative.
Jerry Nowicki is asking, since the state is removing Champaign County and the University of Illinois testing numbers from the regional metrics, should it also remove them from the statewide figures? Are they artificially inflating testing numbers and deflating positivity rates?
Well, thanks for asking, Jerry, because I think there's maybe a misunderstanding. There is, at the campus, there are the saliva tests that are being administered. And that is yielding a 1% or less positivity rate on campus. But off campus, there still are many people who are become infected, and there's a positivity rate that's much higher than on campus. And of course, people that live in Champaign travel to the surrounding counties not infrequently. And so we want to make sure that we're bringing down the positivity rate for the entire region and not having the numbers skewed by the special program that's going on right now at the University of Illinois.
Amanda Vinicky is asking, when deciding which Democratic candidates' campaigns you'll help fund, are you having conversations with those candidates about their position on House Speaker Mike Madigan? And what should the Democratic House members consider as they think about who should be Speaker next?
Well, as you know, we have a general election that's coming up in, I think, 27 days. And your choices on the ballot are between the Democrat and the Republican. And I'm supporting Democrats. I'm supporting Democrats up and down the ballot all across the state. And so I'll continue to do that. My consideration is that the values of Democrats and the positions on issues that Democrats hold are compatible with mine and compatible with the working families, middle class, and people who are striving to get there across the state. So I'm going to continue to do that. The second part of the question, Jordan, sorry.
What should House members consider as they're thinking about the House Speaker next year?
Yeah, look, I think that's up to House members. You know, we're co-equal branches of government. Members of the House are going to make their own decisions about who they want to elect as leaders. You know, I've been very clear about what I think about the considerations about the current speaker, and you know, and I'm going to continue to fight for to pass ethics reform. I introduced it, or proposed it rather, as you know, at the beginning of the year, and we have opportunity now, either in the veto session or in the coming session, to get something major passed, and I've been clear about what those principles are.
Jamie Monks at the Tribune is asking if you could provide some specific examples of cuts state agency directors have proposed, and what timeline do you envision for implementing any cuts during the current fiscal year?
Well, you know, the challenge when you have such a large number to consider is, you know, how to do the least amount of damage. And unfortunately, people who are opposed to the fair tax it seems like the very same people who are opposed to having the federal government provide any funding for any state, let alone for our own state, are forcing us into a situation to make, you know, deep and lasting, you know, tremendously damaging cuts if we had to make all of those cuts. So, you know, you know, they're talking about the things that they would cause would be a massive reduction, for example, in public safety funding. I don't know who thinks that's a good idea right now, or a massive diminution of funding for our evidence-based funding model. I don't know who thinks that's a good idea right now, to lower the amount of money that we're putting into our education system when, you know, we need to fund education in this state better. So, you know, what our agencies are looking at is grant programs. They're looking at their own personnel and, you know, the hiring that they've needed to do. Remember what I got left with when I came into office, which is a hollowed out state government. So it's not like there were a lot of people laying around in positions that we didn't really need. In fact, in the positions that we really need, there was nobody in many of those positions when I came into office. And so as we're trying to just build back a government that actually serves people, it's very difficult to consider, you know, who to lay off among, you know, among those positions. So, but they are coming up with their own ideas about how to reduce costs and, you know, how to make it the least damaging possible on, you know, working families that depend upon our state government.
Okay, this will be our last question today. Cassie Walker-Burke is asking, contact tracing data released earlier this week from your office showed COVID cases were twice as likely to be connected to restaurants than schools, but many Illinois schools remain closed. Do you have thoughts on that and any effort to make a school-specific dashboard available?
I'm sure that IDPH is looking at school-specific reporting, but to focus on, the e-learning that's going on now in the state. Look, I'm very much in favor of trying to get our kids back into in-person learning. However, we want to make sure that it's safe. And it's very difficult at the state level to dictate how each school of the 4,000 plus schools that we've got across the state of Illinois can do that. And that's why what we set up were guidelines for those schools to make it safe for their kids. Many, of those school districts and schools have chosen hybrid models or e-learning models because that is the safest thing for their community and for their kids. So we're going to continue to try to make testing more available, to make contact tracing even more robust, and leave it up to our local schools and local school districts at what pace they want to return kids back into the classroom.
All right, that's all the time we have for today, guys. We will see you again next week. Thanks so much.